and welcome to Slice of Piefer. I'm Dr. Piefer, here with Taylor.
Hi there.
And with the one and only Liz Novosad.
Hi.
We randomly ran into each other at an Astros game just like barely around the corner.
Yeah, like 2 weeks ago.
I was like turning to try to go buy some popcorn and ran into her whole family. Literally. It was awesome.
Literally.
Very cool. And you had family that was there to
Yes.
who were from the other team, right? The Braves or something?
So we were supposed to be going to batting practice for the Angels because my cousin's, I know this is funny, my cousin's brother-in-law is the Angels hitting coach. But they did not have batting practice that day, and we found out as we walked inside the stadium.
Lovely.
Yes.
And we got there 2 hours early.
Nice.
So, but my kids are huge baseball fans, as am I. I've been a longtime Astros fan since, I don't even know. So we went and had a great time and ran into the Piefers and got to see Caroline sing. She did so good.
Yes, Caroline. We were there that early because Caroline had to get set up to sing the national anthem with her whole choir. She didn't do it by herself, but she had a fun time. It was pretty cool.
And my son did that back in April of this year. So it was fun. Yeah. And then I saw somebody with some killer dance moves on the big screen later on in that game.
That is true.
Will that person remain nameless?
It rhymes with Mation Piefer.
Yes. I did make the big screen. That was pretty cool.
You did. Yeah.
But Liz, we worked together for how long? We were at Memorial Hermann Woodlands Parkway for quite some time, right?
10 years.
You were there 10 years?
10 years.
Mm-hmm.
So you started maybe
Right after Caroline was born.
So you started in 2012, 2013.
2013. No,
Right.
20.
She was October 21st, 2012.
Yeah.
So you started right at the end of 2012.
I started in April of 2013.
Gotcha.
Yeah.
And then I started there January of 2014. This is when I met you.
Mm-hmm.
Oh, my goodness.
Yes.
Yeah,
And
that's awesome.
Yeah. It was a fun place to work.
You were helping lead the way for the surgery center?
I started PRN because I was working for a plastic surgeon in the Woodlands at the time before, a year before that. And it was just a really hard job, but I learned a lot. But it was a point where my husband said I needed to leave that job for our sanity and our marriage.
Mm-hmm.
So I was working PRN until we had a full-time position open up there. And I started in the OR, and I did that in the OR for 2 or 3 years. And then when Brenda retired is when I got moved to full-time charge nurse / OR manager. Then it became OR manager.
/ dance coordinator.
Oh, yes.
Christmas party
I am
dances.
still a big dancer, just so you know.
At your current secret job, I bet they don't have dances like ours, do they?
We may have danced to Taylor Swift this morning. So
What?
But
How is that even allowed?
Well, it was a little bit of a slow day.
But did you ever dance there to Baby Got Back and have a certain anesthesiologist who will remain nameless pop up from behind the curtain and say, ooh, rub her smooth skin?
That was the best. None of those dance parties have been as fun as my ones at Memorial Hermann. I will tell you, the people that we worked with were awesome.
Yep. One of whom has a birthday today.
Yes. Happy birthday, Jenna.
Yep.
Hello.
She's got to come on the podcast. She was notorious for dancing.
Yes.
Specifically dancing behind surgeons while they were operating.
I have a video montage. I haven't posted anywhere, but I have a collection of videos of Jenna dancing behind, I think, almost every surgeon at that surgery center.
I would something that would brighten your day for sure to watch something like that.
Yeah, I should really get those out.
Yeah.
And put them together.
When you started there, you were a circulating OR nurse, right?
Circulating OR nurse. I actually worked PACU for a little bit too, because I was just picking up shifts wherever I could get them at that point. Waiting till could get my foot into the door. They had told me a position was going to open up in a couple months, and so I was just kind of hanging on until then. So
they said, "Watch out for Piefer. He's trouble in room 3 all the time."
That Dr. Piefer is the one that is the best to work with.
Yes, I was not trying to set you up for that.
Too bad, so sad.
Yeah,
Happened anyway.
I hear you.
So for people who aren't in the OR, can you describe what a circulating nurse is? What they do?
Oh yeah. So I have been working in the operating room for 16 years, doing my job as a circulator. And my job as a circulator is, as I tell everybody, is I am the go-getter. Not only am I the patient advocate while they are asleep, I am also the one that is instrumental in getting instruments or supplies for the surgeon and the scrub tech that are scrubbed in during the procedure, and just making sure that everything's running smoothly and making sure that nobody's butting heads, so to speak. Not that that really happens, at least not in your room.
Never.
But yeah, I am the one that is your advocate while you are asleep, if you were the patient. So, and I love that. I mean, I remember in nursing school going through that training. You know, you went to like every department, and when I came out of the OR that day, I will never forget it. It was an open heart, and I told my nursing instructor, "That's what I'm going to do. I'm going to be a circulating nurse in the OR, especially in open hearts." And I only did that for like 5 years, but you know, awesome. It was great.
When you started, were timeouts a regular thing?
Timeouts were a struggle. Yeah. Timeouts were a struggle.
Isn't that nuts now?
Yeah.
Isn't that just so crazy to think about?
Yeah. That was the big thing. I remember when I was training, the nurse that was training me, her name's Sandy, she said, you're going to have to be very vocal and open and making sure that you can stop them from doing anything until the timeout was done. And it's a struggle for some older surgeons who are not used to doing that, who are not trained to doing that. Now, where I work now, the doctor is the one that initiates the timeout, and it's just regularly like they have to have their clipboard. I mean, everybody has to be. It's a different from when I started to now, and it's for the better.
But it's wild. So a timeout, just for those who don't know what a timeout is a time where we stop. Everything stops in the OR. We identify the correct patient, the correct site, the correct surgery. Do we have antibiotics? What type of anesthesia are we doing? Do we have all of the equipment that we need?
Patient allergies.
Fire safety is added, is one of the more recent ones as well. But I do remember that when I was in residency, they were implementing this as a thing that had to happen. And you would have thought that they were pulling teeth.
Yeah.
And then when I kind of rolled through residency into fellowship, the timeout was sort of a thing. And then when I started here in 2011, it was like, people don't do timeouts. What are you talking about? And so, and then now within a year of me being here, not because of me, but just because of the way the culture shifted, it happened. But I mean, it's crazy now in 2025 to think of not doing a timeout.
Yeah.
Right?
Oh yeah. Especially with the safety checklist that you have to go over, making sure everything is in place. So, I think it is a wonderful thing, and it's even better when you have a surgeon that is on board with doing it. Because I just remember early on in my career, that was a real struggle for some surgeons, and making sure that it was done and done properly. So,
why do you think that is? Why do you think it was a struggle?
Egos.
100%, right? It's 100%. I don't make mistakes. No. Right? I would never make a mistake.
I'm all about the patient. But you're also in a rush, so let's make sure we have everything before we do this.
I can't tell you. I mean, that to me, it's crazy now to think about, just thinking back that far back to when we started.
Yeah.
And I remember we tried to do timeouts every time at our surgery center in 2011. Mm-hmm. And I remember we had to sit down and talk with the leadership and say, like, hey, we've got to get these you got to do a timeout. Yeah. And you would have thought that it was, we're trying to rewrite the Constitution of the United States of America.
Yeah. And when I was in school, timeouts were part of it. I started PA school in 2011. And so when I went on my surgical rotations in 2012, it was already a thing. Like every surgery had a timeout. And this is with cardiothoracic surgeons. And they were all on board with doing it. Luckily, I did my training at Memorial Hermann, and they were all on board with that as part of the culture. But then I went to a more rural area, and I remember looking around like, we're just going to start.
We're just going to start.
Okay, got it. And thinking that it was just bizarre. Like I felt like something was missing. And how many times when we do a timeout do we go, did they get their antibiotics? And then somebody go, oh
wait, I forgot.
Yeah, we haven't done those yet. Let's take care of it.
Yeah.
It's caught things. Just a few weeks ago, we had a patient that you always check the site, right? Look for the mark from the surgeon.
Oh, this is pretty funny, actually.
So,
and not funny, but it's interesting. So
he writes his JP on this person's medial side of their knee. But at that point, the patient then brought their knees together and transferred the signature onto their other knee.
Pen hadn't dried, yeah.
Yep. And they didn't have anything on that other side, didn't have SCDs or anything. And so when I went to go put their tourniquet on, it was a tourniqueted procedure, I looked, I was like, I've got a mark on both knees. And I mean, it didn't look faded. It looked like two solid marks. And so I had to go look at the consent and do everything. And that was a teaching point for us of, okay, from now on, signatures go on the lateral side so that that doesn't transfer over.
Yeah.
And I think I usually put them out. Like I have no clue why I put the mark
you're
towards
pretty
the
good
towards
about
the medial side of the leg. Like I don't know. I think we might have been doing an ACL or something, and so I was maybe trying to stay away from the quad incision, and then maybe trying to stay away laterally. I have no idea, but I didn't think twice about it when I put the mark on her. And then when we got in the room, it was like a mirror image of marks on the medial side of her leg on both legs.
And
I was
that's why we have that in place.
Mm-hmm.
Yeah.
So-
I mean, I've seen it. It's I haven't seen a wrong site, knock on wood. But that's probably, excuse me, because of the timeouts. And there have been times when we have gotten close though. And, the consent was right, but everything was done. The consent had the correct side, but everybody marked the wrong side. The whole room was set up for the wrong side. Then we get in the room and we're like,
it was all posted in the wrong.
and they're like,
everything
and now they do a timeout in pre-op. They do a timeout with anesthesia before you get a block. And everybody just had the wrong leg. But it was the right leg because it was a fracture. So obviously it's not like the wrong leg got marked. It was just one thing was wrong.
Right. Yeah, we have it. I think now they do timeouts before the block, both at the surgery center and at Memorial Hermann Hospital. They do the timeout at Memorial Hermann. They have a timeout, an anesthesia timeout before they put the patient to sleep.
Yep.
So they do an anesthesia timeout before that, and then they'll do a timeout once we're prepped and draped and before we make that final cut or before we make the commitment. We have one more timeout where everybody has an opportunity to hear and participate and make sure that they know where we're going. So.
Yeah. It's definitely been where I work now it is a part of the culture, and it is drilled into, these surgeons go and grab their clipboard and make sure everybody is silent and everybody is focused. You have to have hands up, everybody pay attention to the patient. So it's a good thing as compared to like the beginning of my career when it was a struggle.
It takes 60 seconds, maybe.
It does.
It barely takes any time at all. And
it's caught
crazy.
some things, like you said. It's a good thing.
Yeah. Do you guys do a debriefing afterwards?
If there is something that goes wrong or if there is something that wasn't right, we do a debriefing. But sometimes we do, sometimes we don't. But it's mainly if something arises during the case, then we will sit down and debrief. And sometimes that's a process too.
So we don't do it all the time.
Right.
But when I was in Taos, we did a World Health Organization debriefing after every case. And it was also about 60 seconds. You should talk to especially if they like doing that stuff. The cool part about it to me was that you go around the room and every person in the room has an opportunity to say whatever they want. They can say what went well, what didn't go well, what they would do differently. And most of the time it was simple stuff like, hey, let's make sure that broken piece of equipment gets fixed. Or, hey, let's make sure if we're doing, if we know there's a chance of a meniscus repair, let's make sure we have the meniscal suturing equipment in the room, right? But what also happened is that most of the time, as you went around the room, when you got to the surgeon basically said, everybody did great. This was a great case. But that got written down. And so for every person who was in the room, every time that they got that written down, when they went and they had a review with their supervisor or something, they could say that. And as a surgeon who is leading in the room, it also makes a huge difference because if you're telling everybody how good they're doing, when you do take that time to say, hey, one thing I really felt like maybe we weren't on it as well as we could have been today. I don't know what's going on or something like that. Then they really listen to you because it wasn't like you spent your whole day just berating somebody all day in the OR. And so I really, really liked that debriefing just because it allowed for that. And it allowed it allowed the staff to give their feedback too.
Yeah.
So, we even had a moment in an operating room where somebody called somebody a name and the culture was so good that the scrub tech looked him right in the eyes and said, hey, when you called me that was not professional and I don't appreciate it. And the surgeon apologized and then we moved on and nothing happened. Nobody, but
that's
also
key right there, documenting
it got documented, but also you move forward and it wasn't like, hey, we're going to go have 12 conversations about how the surgeon called me such and such, right? And let that keep building up and let the environment get so crazy. It was this moment where you could just get rid of that and be done. And you were in an environment where it was also safe for you to be able to do it. And
I wish more surgeons, especially those difficult surgeons, which we've all interacted with, would take that feedback. And sometimes, because we've been in conversations before.
Sure.
That even when you tell them that, hey, this offended me, they still don't think much of it. They still think that
that's a you problem.
Yeah, but they don't see it that way.
Right. That's what they think, though, is that that's
it's a
your
It's
problem. It's not my problem.
It's a narcissist characteristic, right? So, but you live and you learn. I think for staff getting that off of their chest, if something like that was to happen, I think a debriefing is a great tool. And I remember you were really doing it before I left the surgery center.
But it just makes such a huge difference because there's times when you feel like, man, life is really tough. It's December. We're working overtime every day to get pushed through and all these things. And if you had an ability to sit down at the end of December and say, hey, let's look at what Dr. Piefer said about your performance. I was like, great job, exceptional work. You were awesome. I really loved it when you were ready with these things. Like all those different things can help build people up and it just show people like when you get a little bit blinded by the difficulty and by the job, that people really do appreciate you and that the surgeon appreciates what you do and that the job you're doing and the work you're doing is changing somebody's life. And that part I think is just beautiful. But it's so easy to lose it. It's so easy to lose.
So easy.
Not lose what you're doing, but to lose sight of what you're doing and to lose that knowledge of like, okay, as a circulating nurse, I'm a part of a team who's changing somebody's life today. Like at 9 a.m. this morning, we are changing the life of a patient.
Oh yeah.
And then at 10:15 a.m., we're changing the life of another patient. And
I think it's so
crazy.
easy that it can get lost. You can get lost in that too. I mean, because the OR is such a routine for a lot of people, and you have not that you're doing the same thing every day, but you're doing the same typical things that you would do. Like you're setting up your room, but it kind of gets lost that you're there for the patient. You're there to change their life, and some people just take that for granted and just forget about that in that moment.
Right.
Because it's just a job. It's just a paycheck for some. But I think being reminded of that is something that is key. And for me, I left the surgery center and it was a very hard choice for me, but I felt like I was getting lost. I felt like the job had become routine. I felt like I wasn't getting listened to a lot by the other leadership. And so for me, taking this new job, the job that I'm at, that I absolutely love, it's been a real gift in the sense that I feel like I have that back. I feel like I'm there. I feel like I'm making a difference. I feel like I am there changing a patient's life every single day. And I am. And it's a beautiful thing. And it's brought my love back for my job. So that was a big thing for me.
Yeah, absolutely.
And which reflects back into my home life. So things are great at home again.
It's amazing what that kind of shift can do for you mentally.
Yes.
Just
huge.
You think about things like, there's these people who tell you like, okay, so if you're struggling with, anxiety, depression, or whatever it might be, part of it may be the environment that you're in, and just making that shift of going from something where you feel maybe burnt out or maybe unheard or not listened to or appreciated, and going somewhere where you feel those things and feel you can give that, not only to your coworkers, but to that person, that patient.
Yeah.
That makes a big difference. And it just cascades everywhere else. Your personal life, you feel like you've got more ability to take better care of your family, yourself.
Mm-hmm.
Right?
Oh yeah. It is a huge mental shift, and it's been a blessing. And my husband, when I got offered that job, told me if I didn't take that job, we were going to have some serious issues. So
he's done that a couple of times now. The plastic surgeon office, then this one.
He knows. Goodness. I mean, I love my husband to death. He is my biggest supporter, and he can sense when and any person who has that, who struggles at work, is you bring that home. Same thing if you're struggling at home, you're going to bring it to work. Mm-hmm. So having that balance, the work-life balance, is huge, and I have that back again, and it's been beautiful.
How long have you and him been together?
17 years. We've been married it'll be 15 years, but we've been together for 17 years.
That's awesome.
So
yeah, he knows you well.
He knows me well, yes. Like I said, biggest supporter too. So
for me, having that insight taking that moment, right? Just taking a moment every day, taking a moment a couple of times a day to just be grateful for what you've got, and to be grateful for the people who are with you, and to focus and recognize like what you're really getting to do, right? Like, cause I mean, if you're just like, oh, I'm replacing another knee, and it's weird because we work in an environment where that's the whole point. Like the idea is we're going to isolate that knee or that ankle, right? And we do it with the drapes, right? We block everything else out, and all you see is that foot, or all you see is that knee. And it can become very routine to say, all right, we're going to replace this knee. And you're just trained to go through the process and to make sure that the knee is balanced, make sure everything is where it should be. It's not like you're rushing through it, but the idea that knee is still attached to somebody who's on the other side who you're going to get a chance. And as a circulating nurse, you don't get the chance necessarily to see them besides maybe some of that feedback that they send, but we do.
Yeah.
Right. We get to see them as outpatients and get to see them when they come in and when their knees are doing great. And also when their knees are a little stiff, or also when they're not having so much fun going to physical therapy.
Yes. And then they get to come back for knee manipulation, and I get to hear the crinky noise because that was my favorite.
It's also interesting because, again, in working with a few surgeons, I've definitely seen where that can be the case, where they isolate the body part and we just, every one of them we do is the same. You, again, I know you don't like when I'm shouting you out, but you are different. You say things like, well, this guy, though, he plays guitar, so we have to make sure he gets external rotation. Otherwise, he's not going to be happy because he can't play his guitar. Or can you pull up this guy's occupation? I'm pretty sure he's a machinist. Like, you ask and think about the patient very individually every time we're in the operating room. How many times have I had to go and call the staff and be like, hey, can you pull this up? Because Dr. Piefer is worried about making this surgical decision that's going to affect this, and I mean, I'll give you a lot of credit for that because I haven't seen that really.
Well, thanks,
otherwise.
Taylor.
I agree. I mean, there's a reason why I sent both of my parents and my children and everybody else to come see you.
Well, I
you have that
very much.
You have the personal side to it. A lot of doctors, a lot of surgeons are just, I feel like some of them are just machines just going through the motions. They forget that there is a human aspect to it. Sometimes. I mean, I'm not saying every surgeon's like that, but some are. So when you find a surgeon that does really listen, it is refreshing. And it is why you are my favorite surgeon.
Well, and
well, thank you for that.
If we're bringing it around, I would say the same thing about you, Liz, is that you think about the patient and you are their advocate. That's why if you were my circulating nurse in the room that day, it was going to be great. I wasn't going to have to worry about that kind of stuff because you were always on top of it. You knew, the background, you talked to the patient, you identified, you were good about getting equipment in and out. I mean, and anything we needed, you were always there. So it was easy enough, especially as a baby PA who was coming out of PA school going, help me.
Yeah.
I don't know nothing.
But it's always patient. It was always patient first, right? You were always patient first. You always were there. And that takes a ton of courage, right? That takes a lot of courage in a moment where you're in a room, potentially, with a surgeon you're not his employee, right? No. You're not he didn't hire you.
Not his peer.
You're not his peer or her peer. There's, but by the same token, you have to have the ability to have the courage to speak up and to say, hey, that's not sterile. Or, hey, this is, and if they say, yeah, it is, as a circulating nurse, you still can trump that and say, no, we're getting new equipment. We're getting something else new. Or let's just move forward. And ultimately, I know that the final say, right? I think if the surgeon was just going to slam their foot down and say, we're going to do this, it didn't put you in a really tough situation. But you have that ability from both your background and your role in the room that you can stop it if you needed to.
Stop the line. That's a big thing that we are taught. Stop the line. And
that's not easy. That is not an easy thing to do.
And I've done it, and I will do it again if I have to. But it's not easy. But it is why I think I love my part of my job is that I am the one that is advocating for that patient. You are asleep. You are incapacitated. You have no idea what's going on. I do. So I'm going to make sure that that's getting done right. So,
and that's a crazy amount of trust. Like, I think, I just like, to me, Taylor and I have talked about this. We've talked with several guests about it, but it's just like that idea. Like, if you really think about it, I'm going to put my life into your hands as a team that's in the operating room, whether you're the anesthesiologist, the CRNA, the anesthesia assistant, you're the circulating nurse, you're the scrub tech or scrub nurse or OR surgeon, PA, whoever it is, this entire team, I trust you,
Yeah.
right? That you're going to take care of me and do everything right.
Yeah.
And that's a big responsibility that we should really take quite seriously, right?
We also make the worst patients because of it too.
Yes, also true. Also
because
true.
we know too much.
Right.
But yeah, it is a huge responsibility, and I don't take it lightly at all. I mean, I think it is why. I mean, I became a nurse because I've always wanted to become a nurse, but after being in the OR for so long, it is why I take my job so seriously, because I am your voice. And I don't mind being your voice. I love my job.
So how do you combine that seriousness with having fun and enjoying what you do?
Oh, well, there's a time for seriousness, and then there's a time for playfulness, and there's a time for both. And I try to keep it as lighthearted as possible, because if you think too much in depth, just like how we make the worst patients because we know too much, if we think about the worst part of what could happen, it could. You just have to, I don't know. You have to make it fun.
Right.
Otherwise,
find the
just
joy.
going through the motions.
Well, there's an art and a skill to learning. I mean, what you get with time and being in the operating room for when there can be levity, there can be fun.
Right.
And then there's times where things have to buckle down and we have to be very, very serious and focused on exactly what we're doing. Only time and experience, in my opinion, is what brings that about. So,
you can tell the shift in the room when they say read the room. I can read a room very well. When the surgeon starts getting quiet, I know something is either not going their way or there's something that could potentially go wrong. And so I try to stay focused. And then you also communicating with the eyes with your scrub tech. Like, I mean, there's so many conversations that I can just have by raising my eyebrows sometimes. But I'm really good at reading the room. I'm really good about going with my gut instinct. Sometimes I don't know what it is, but sometimes I just have a feeling that something is something bad is about to happen. I just need to be prepared. Sometimes my gut is spot on. Sometimes it's not, but I'd rather be prepared in that moment in case it does happen.
For sure.
Yeah. I'm good at communicating with just my eyes.
you say it best when you say nothing at all.
Oh no! There
should we
you
start
go.
singing it?
Yeah, definitely. You two. You two should sing it. So, in terms of also being prepared, you have done a certain number of F455 exercise workouts. I hear
F45. I have been a founding member at my F45 since it opened.
Nice.
So I've been a member for 3 years, and I'm at 300 classes. I should be at way more, but I kind of realized I was getting old and hurt my knee a little bit, so had to do a little rehab on it. But now I am back at it gung-ho, and I've hit my 300th class, and I'm not stopping.
Congrats.
Taylor, how many classes have you done?
I think I'm up to 80.
Yeah.
Which
Nice.
I started in June, end of June.
We could have put F45 like right up here.
So what do you love about it?
I love that it's only 45 minutes. I don't have the attention span to do much more than that, or the lung capacity. I feel like some days, although on Saturdays it is an hour long. But I just love that it's something different every day. I do love that there's cardio days. I love that there's strength training days, and then the combo of the days. So I get to kind of pick and choose. I mainly do just the strength days right now because I gotta get strong.
Nice.
But it fits in my schedule. Like I said, it's 45 minutes. I go at 5 a.m.
Do you nickname all of your co-exercisers like Taylor and her family do?
I heard about that.
If you go to F45 with Taylor, she has a nickname for you. Spoiler alert.
Dr. P. Come on now, don't tell my secrets.
I have some. I just don't say them out loud because sometimes
I have
good.
nicknames for pretty much everybody in my life. Let's be clear, in the operating room, everywhere, and so everyone's
This is true.
So it's not unique to F45, but so
you do.
So
What about the guy from the coffee shop this morning?
hey, again, Dr. P. A guy at the coffee shop this morning told me I smelled nice.
Aww. Compliment guy. I like it.
Yeah, that's what we'll call him. Compliment guy. Good, Liz.
Thank you.
It was only a little weird because I was like, oh my god, and he was a pretty attractive dude.
Oh,
and so it was even. I know, and I was like, I'm just gonna step this way.
it's okay.
Yeah. But then, of course, I came in here and I was like still blushing about it, you know.
You know what? We got to take it where we can get it.
Yeah. Yep.
I love it.
Yeah.
That takes some serious moxie to just be in the coffee shop to a random person and be like, "You smell really nice."
But here's the thing is he definitely, this person, I don't know anything about him. Don't know his name. Don't nothing. But I bet that I am not the first woman he has told
he smelled
that she smelled nice, and I may not be the only one he tells that today.
I like to make it a point though to if I see somebody like and they have something cute on or they look nice, I do like to tell them because people need to get a little smile on their face here and there. And if I'm the one that gives it to them,
Yeah.
I'm happy to do it.
But
So.
at F45, my nicknames for people are typically because depending on what workout I'm doing. So I'm all over the place because I have small children and my husband also works out. So we have to really coordinate when we go. So I don't consistently go to any one time. So that's one of the things that, you know, for my husband and I both do it is I'll be like, oh, so-and-so, these people were there. And if I don't know their name, they have a nickname.
Yeah.
And he knows exactly what I'm talking about based on the nicknames. And they're
I
not
feel
mean.
you.
They're like,
No.
they're nice.
Yeah.
You know?
Gandalf.
Well,
That's Val's.
That's Garrett.
Yeah, that's Val's husband. And he gave himself the name the Gray Wizard. I didn't give him that one.
That's because
Gray
he's been
Wizard.
going gray. I remember when he wasn't gray.
Yeah. And then there's one that's the mayor. And guess what he calls himself? The mayor. Like, I didn't give him that name.
John Mayer.
No.
Oh,
God,
I
God
do
bless
love
John
me some
Mayer.
John Mayer.
God bless
Love
John
him.
Mayer. Man, I didn't know I was
his
gonna
wiffle ball.
lob that one up there for you guys.
We have similar music.
Yeah.
tastes.
I went and saw him on my 40th birthday in the 10th row. That was my
Really?
gift to myself.
Nice.
And it was worth every penny. That I got at face value because I just got lucky in the
Really?
ticket lottery of life.
Hopefully
Nice.
he wasn't status post wiffle ball injury like he was when I saw him.
No.
So
I've seen him a few times, Taylor.
I believe it. The only time I ever saw him in the Woodlands, he was injured.
That's what I sing to myself when I look in the mirror. Your body is a wonderland.
You sing it to yourself.
Yeah.
You know that song was written about Jennifer Love Hewitt,
yeah,
right?
exactly.
But I sing it to myself.
He was like crying about Jennifer Aniston the last time I saw him in concert.
Oh.
Yeah, and he was like singing "Perfectly Lonely," if you know that song.
I do.
And he's like, "I am lonely."
I
so
just,
melancholy.
I don't know. I love him. I have loved him since I first heard his first album.
How do you not?
I know.
He's weird and he
And
makes
he's so-
questionable life
Yes.
choices. But
And he makes the funniest guitar faces. And
do you
you
remember
just,
seeing him on Dave Chappelle?
yes. I'm like my two favorite, Dave Matthews Band and John Mayer. Like I will go see them wherever, whenever. And I know that's like so cliche.
You're speaking my
all
language. I like the things where you see like Dave Matthews dance.
Except
and
she
they're like,
likes Weird Al.
ain't no songs that Dave Matthews needs to be doing all that. And he's like,
Yeah, that's my thing. I
I
love
do
it.
like
good.
Weird Al, but that's okay.
Yeah,
She like-
and
she likes Taylor Swift, and I'm not a Swiftie.
Yeah,
So we
I do.
We can respect each other's differences.
will admit though, I was not a huge Swiftie until I went and saw her from this Eras tour. I went with my sister. She wanted to go. We went. My dad went with us.
That's where you bought those glasses.
No, yeah, maybe. I don't know.
I love the glasses, by the way.
Thank you. Yeah, and then afterwards, after that concert, I went, "Oh, I get it now.
She puts on a show.
She does, man." And I really like the new albums.
What did you get?
What do you mean?
You said I get it.
Oh, I get why people love her. I get why the girls love her. I was not big into it. I mean, I liked her songs on the radio, but I wasn't like listening to every album, every song. But it was a really good show.
Bet you Travis Kelce told her she smelled good.
In a coffee shop one day.
If Travis Kelce told me I smell good,
Yeah. We've been talking about your husband quite a bit here, by the way.
by the way,
is.
he knows.
This is someone who's on the hall pass list, is what you're saying, Travis Kelce?
I mean, the hall pass list has 5 people. We have 5 people on our hall pass list. And I have not added Travis Kelce, but if I add Travis Kelce, I have to take somebody
you
off.
have to take somebody off the list. That is the rules of the hall pass. That
It
is true.
is.
Very true.
I really want to guess. Who's on your list.
Ready, go. John Mayer.
Yes.
Really?
Dave Matthews.
Yes.
Boom.
I know.
Hey, read the room. Read the room, Tay-Tay.
I know that you.
There's
a
a certain football player
Okay.
who is now on
Patrick Mahomes.
CBS as an analyst. JJ Watt, of course.
Would he have to be wearing the elbow brace?
No.
Does he have to have a knee brace
Might
on?
have to wear one after.
He might have to. Hard rock. That's a line from a Taylor song. I'm sorry.
Yes.
Is another one of them an actor who's from Boston?
No.
I thought you might be a Mark Wahlberg.
I mean, I do love some Mark Wahlberg. I mean, he is the investor of F45.
Mm-hmm.
And he's actually one of the reasons why I started doing it.
That's why I was thinking maybe.
No, but maybe, I could add him.
Yep, you got to drop somebody else, though.
I know.
It's the rules of the hall pass are pretty tough.
They
It's
really
pretty tough.
are.
It's very strict.
Yeah.
It's like a timeout in
And
the
it's
OR.
never going to happen. So it's why it's a beautiful
Just
hall
bringing
pass.
you back around. It's
The clip from this goes to, it's basically the time.
Basically, you're never going to succeed.
Basically, if anything ever happens, we just have to drop it off the timeout.
My favorite is when people talk about like the hall pass list and somebody's like, oh yeah, the girl who checks me out at HEB.
Right. Someone
like,
who's very accessible.
No.
Yes. That can't be
Somebody
it.
you can never,
Yeah.
it's never,
It's never a thing
Yeah.
that's going to happen.
Yeah, that's true. Well, speaking of things that may never happen, you see that? You see
Segue.
that?
Is this your F45
got-
class you're going to do with Taylor and I?
Oh,
Did you
no.
think I
That
was gonna
You did flip
forget?
that. You did
I
flip
I've been
that.
so nervous about this.
I flipped it
I'm
and
not
reversed it.
nervous.
You've
I'm
only
really-
brought it up like 5 times today. when
You
he was
brought it
having-
up in Val's episode.
The probability of me not surviving is very high.
I
Very
think
high.
if we did a strength class, you'd be okay.
Yeah, that's what I
Yeah,
told
but
him.
that's
I'll
not
start
what
with
Taylor
cardio.
said. And Taylor said that her significant other is looking forward to seeing me throw up because that would make him respect me a little bit more.
Jeff has done one class. One.
Yeah. Well,
And-
he's smart.
He's said-
appreciate your intelligence.
He said, you can continue doing this. I'm good.
You are good.
So wait a
Yeah,
minute. If he's
so-
smart because he only did one, what are you saying about me and Liz?
Reading the room again. Everybody's so good at reading the room here. That's the key. That's the key.
I see.
But Taylor's husband. does
So,
it,
Yeah, he
Taylor,
does.
Dan does it.
Dan is probably stronger than Taylor
most
and I.
people.
Well, he's a male. He's got more muscle mass. He played rugby. Like, he does
I
all these
lift more
crazy
than
things.
some males that are
I believe it.
45.
There's one. There's
I'm just going to say.
There's one person I've seen on occasion, very rarely, but they come to the 45 class every now and then. And, it's a strength training class. So the whole point is progressive overload, right? So you're supposed to start light and then work your way
Way
up,
up.
right? Which is, if you get
Standard.
to where you are at and you're struggling, that's where you stay. You don't push it further than that.
Sometimes I get a little overloaded just
But
sitting
I
down.
see this guy go and get the 2-pound weights.
Oh,
And I'm like looking for surgical incisions and stuff. Like, is he injured or what? No, that's just where he's happy. And my husband and I
I
both,
like that guy.
but we think we have created a story in our head that this person lives at home with his mom, and his mom says you got to get out of the house once a day. And so he shows up at 45 and he does the minimal amount of work possible so he doesn't sweat, and then he goes back home.
Nice. Nice.
That's the
probably
background story.
accurate.
we
He's
created.
probably definitely watching, so you called him out pretty big time here.
Yeah.
Well done, Taylor. Thank you. We will send an apology letter from Slice of Piefer, and we'll send you your
He gave
favorite
no
pie
identifiers other than the fact that it may be
to
a
the
male,
2-pound
or
weights.
is it?
The 2-pound weights?
The 2-pound weights might be a dead giveaway, though.
Those are the ones that my son Axel, who's 4, picks up when we go into F45 and lifts up. And he's like, "Mom, these are too light."
I don't even think they have 2-pound weights at my F45.
They put them up
No,
sometimes on the mats when we do
I
the
need the
punches.
1-pounders.
That's it.
The 1-pounders for me. I really want to overload.
They're gonna give you some soup
I want
cans.
to overload on the 16 ounces.
Some 12
Hold
ounce
these
curls.
Campbell's soup
Yes.
12
cans and
ounce
push 'em.
curls.
Yes. So a few questions
Yeah.
before we wrap up our fun time here today
Sure.
with you. Number one, we understand that you work at the Secret Service and that we will not dive into. But if you were not working for the Secret Service or in medicine at all, what would you be doing?
A teacher.
You would teach.
Yeah.
What would you teach?
I go back and forth on that. So long time ago, when I was trying to get into nursing school, I actually applied for my Region 4 teaching certification at the same time I was applying for nursing school. And I got accepted to both at the same time. Obviously, I chose nursing. But I had dreams of being an elementary school teacher, but now that I have a middle schooler, I think I would really enjoy the middle school kids because they just need they just need a little bit more.
They're crazy.
They are, but I just think they're a fun kind of crazy.
Yeah. Well,
I think you would do well with that age group.
You're living.
For sure.
Yeah.
You're living in a world of rose-colored glasses. That's what I will tell you. I know a lot of middle school teachers.
Yeah, I know.
And they love their lives, but maybe not as much at school.
I feel like the school year is a little bit different now that they can't have their phones.
Oh yeah, no doubt. Although my kids have never had phones at school because they've been at St. Anthony's. So, and actually the middle school teachers there, they love their jobs. So it's easy peasy.
I had a 13-year-old patient that I saw in the clinic that came in for an ankle injury. She said something like, I didn't text message my mom. I mind messaged her. So she knew I had hurt. And I died. Loved it.
Nice.
The phones are a tricky topic with those kids.
It's a distraction, man.
Yeah.
It's a crazy distraction.
It's a distraction for adults.
Amen.
So, yeah.
I'm guilty.
Oh,
It's tough. Open it up and it'll take away. You'll rob yourself of 10 minutes of your life before you even know it's gone.
Yeah.
Mm-hmm.
It's crazy.
I've really had to make a mental push to really put it down when I'm at home and not pick it back up until they're all asleep.
No doubt.
Yeah. I typically just use mine nowadays for audiobooks. That's the only thing that I still am a little bit guilty of. I'm not bad about social media or anything anymore, but if I'm doing mundane tasks around the house, I'll throw a headphone on and listen to an audiobook.
Yeah.
And
whatever Libby gives me.
Right. Well, I'm in a good one right now. I'll tell you about it after these wraps.
After we get wrapped. Let's see. Oh, the difference. So you've been in leadership positions.
Yep.
You've both been a leader and you've been led, as most everybody has.
Yeah.
What do you think separates the good leaders from the great leaders?
Leading by example. I think I've always thought that you should always lead by example. My dad worked in the corporate world forever, climbed the corporate ladder, went all the way to the top of some. And he always said to lead by example. And so I have always remembered that. I tried to do that when I was a leader. You didn't really see me sitting behind a desk that much. I tried to really make myself present and tried to be positive because I know how hard the job is. I think having a leader that's actually done the job, I think helps.
Yep.
I currently have a leader who's never really been in the OR before right now. And she's great. It's just sometimes I have to explain things a little bit more in depth of why we have to do certain things a certain way. But I think leading by example is probably one of my biggest things. So not to be a hypocrite, not to say one thing. I think that's a big thing in our country right now, the hypocrisy going on. But I think, saying something and actually doing what you're saying and practicing what you preach.
Amen.
So,
I agree.
yeah.
What's your favorite kind of pie?
Lemon meringue.
Man.
That one right there.
Like the one that's been sitting here with
That I've been
sprinkles.
staring at.
With sprinkles. You do not have to eat it on the air, so just so you
What
know.
if I just stuck my
But
face in?
you could stick your
That
face
is
in
a
it.
choice.
Listen, we are looking for ratings. We have at least 100 people who've watched one of our episodes, so that's pretty good.
Hey, maybe I can spice it up a little bit.
There you go. Well, Liz, I love you. Thank you
love
for
you.
coming. Thank you so much for being here. Thanks for taking the time out of your day, away from your family, away from work, and to come out and just talk with us and share where you are. It's so great to see you. I was so excited to see you at the Astros game too. That was
It was
awesome.
a happy day.
But I sincerely want to thank you for being here.
Thank you.
Taylor,
miss you.
thank you also. Yeah, we do miss you. We miss you. I mean, inside there's a card inside the lemon
Inside the
meringue.
pie.
Yeah, in the pie. So you got to eat it first. We won't tell anybody. So, but
I
thank you
miss
so
y'all
much.
a lot. I do. I loved that job. I don't miss that job. I miss the people though.
Yeah.
So
Well,
Understood.
you rock. Thank you so much again for
Thank
being
you.
here. Have a great and wonderful week. And we'll
happy
bring you
birthday,
back
Jenna.
anytime. Happy birthday to Jenna.
Happy birthday,
know,
Jenna.
Just come tell us anything you want, Jenna.
Oh, she will.
Or come dance.
Yeah.
One of the two. You can dance behind Dr. Piefer while he does this podcast.
That's right.
I will get the montage. That can be your intro.
Yeah, and we got to schedule the F45, right?
Yep. We're going
Is
to
it
do
F45 or F46? I don't know.
F45.
You're going to learn. You're going to count every minute.
That is true. Hold on. We got to play you out.
Okay. White girl dance.